Hi everyone, and welcome to our webinar. My name is Lauren May with HIE Systems, and I will be your moderator today. Before we get started, we have a few housekeeping items to go through. First, if you should need any technical assistance during the webinar, you can head over to the question section in your control panel or reach out to me via email. If you have any questions about the content of the webinar, feel free to ask them at any time by submitting your questions again in the questions pane in the control panel. Just so you know, we are recording for quality purposes. And finally, at the end of the webinar, there's a survey you can take. By taking the survey, you will be entered into a drawing for a chance to win a $100 Amazon gift card. The drawing is held at the end of each month. And now I'd like to officially welcome you to our webinar, Integrate Your HIE with EHR Workflows. Thank you all for attending. Our speaker today is Rich Murphy. Rich is Director of Interoperability Solutions at HIE Systems. Rich has a Bachelor of Science degree in Engineering, a Master of Science degree in Computer Science, and more than 15 years as a healthcare IT professional and integration strategy expert, in addition to being an experienced programmer. And now I will hand it over to Rich.
Thank you, Lauren. Good afternoon. Thank you for attending today. Today, we'll take a look at our Flex Button solution. We'll explore how this can be used to help your participants access your HIE and solve some common clinical workflow challenges that we've seen. I'll demonstrate two use cases where we did use our Flex Button solution to solve real-world workflow challenges which were being faced by HIEs and our hospitals. And I'd then like to open the session for general questions and answers to discuss any specific challenges where FlexButton may be able to assist with your HIE. Healthcare IT News just completed their annual EHR satisfaction survey this past fall in October, and I wanted to share some of the results with you. Some of the results may apply to how hospitals interact with your HIE. Here are just some of the quotes that people replied from the survey. All of the interoperability areas relate to wanting access to data outside of the EHR, like an HIE, for example. And users want to be able to do that easily, have it be painless, and have it be flexible. And this is exactly what FlexButton can do. FlexButton can query HIEs, return relevant data for a specific patient, help the care team make real-time clinical decisions with that particular patient, for example. And I'm sure that some of you have heard similar requests from your participants. So there have been several studies that show how accessing HIE data can save money in reduction of tests, improving care, and you've probably all seen this information before, probably nothing too new for this team here today, but just a few stats that jumped out at me that show how powerful it can be by providing clinicians easy access to your HIE. One study from the University of Notre Dame said that well-aligned federal incentives along with HIE use could reduce Medicare costs by more than $3 billion, billion with a B. So definitely has some exciting numbers there and real world numbers. So let's take a look at some common workflow challenges faced by healthcare users when accessing data from the HIE. First item is something that I'm sure we can probably all relate to. Needed to toggle or bridge, between two disparate systems. So from the hospital system, practice system into the HIE, for example. Oftentimes, in many scenarios, users may need to leave their EHR, enter sign-on information for the HIE, maybe log into a portal, log into a website, run some software on a machine, for example, to get to the login portion of the HIE, manually enter their credentials, and then enter a patient identifying value just to get to the point of identifying the same patient's record within the HIE. So that process right there, it's not only time consuming, for one patient, it's probably not monumental, but those patients add up, throughout the day, user by user. So it's not only time consuming, but manual data entry to pull the same patient's record up in two different systems, it can lead to typos and inaccurate data entry. And all of that really adds up to end user frustration and inefficiencies. Happens to me as well. I was just doing one earlier today for a hospital, just cutting and pasting a patient identifier from an email into their system. So anything we can do to automate that and make it electronic instead of manual just makes it easier for everybody. And oftentimes, in many cases, patients may have different identifiers across different systems. So for example, I'm sure the HIEs are familiar with this, just different patient numbers, patient identifiers. The more systems you have, the potential increases for the more identifiers. The end user, though, might not know the correct patient identifier to use each and every time. So an HIE may require a unique patient identifier, which ultimately is available somewhere within the hospital system, but the end user may need to do quite a bit of research, maybe checking different screens with different locations, just to locate that patient identifier within their hospital system. So that account number in my example. I've had customers comment that, a few real world examples. One customer told me that their users write down the user's patient identifier on a piece of paper, then they manually go and key that into the HIE each time, probably pretty common. And I also had another one with a nursing workflow. They said that their nurses write down the patient identifying information. Their words were on the back of their arm with a pen. So I picture nurses doing that each shift, and to me that's kind of comical. And then they manually key that into the outside system just to pull up that patient's chart. So those are writing it down on a piece of paper, back of your arm with a pen, for example. Those methods can be somewhat effective, but first of all, it's inefficient, and second, it's insecure. We don't want that patient PHI data floating around when it doesn't need to be. So this can be solved programmatically by writing code to extract the correct patient identifying values from the user system and to pass that information automatically behind the scenes with programming so that the user does not have to go in and key that in each and every time. Oftentimes, users on the hospital side or the practice side, they may not know what they don't know, so to speak. There could be valuable clinical information in the HIE right then and there, real time, that could help the user better care for that patient at that point in time, but the user just doesn't know that that data is there. And oftentimes data isn't just needed as view only, but we're seeing an increase where users want to actually jump out to an HIE, for example, and actually pull data. Oftentimes users want data from the HIE to make its way back into the hospital system. So it's not only viewing, but actually bringing data back in as well. And if you don't have a programmatic way to do that, oftentimes that's accomplished through manual data entry. I had another customer tell me that they pull up a patient chart on one screen, they were in the HIE on another, and they were just doing a cut and paste, highlight this part of the record and paste it in over here on the hospital side. So, effective, but not the most efficient way to do it if you can do that with programming. So these are some of the key challenges that FlexButton was created to address. Let's take a look at each of these challenges and ask what if. What if clinicians could jump to the patient's record in the HIE with just a simple button click? With the Flex button, users can easily access the patient's record in the HIE with just a simple button click. We'll see an example of that here in a moment. What if the workflow could be automated to bring patient data back into the EHR from the HIE? With the Flex button, users can automatically bring patient data from the HIE back into the user's starting system. What if clinicians could be alerted when new data on that patient resides in the HIE? With FlexButton, users can receive real-time visual indicators, alerting the user of the presence of important clinical information for that patient real-time within the HIE. And what if clinicians could push one button, jump to the HIE, and bring data back into the EHR? With the FlexButton, users can be notified of data in the HIE and can access that patient's record in the HIE with just that simple button click. Again, we'll see an example of that here in a moment. So next, I wanted to show two use cases. Lauren, for the crowd here today, if we could, if anyone has any questions, please feel free to type those into the questions panel. And Lauren, if there are any questions after this first use case, I'll pause for a moment and see if any questions came in.
Sounds great.
All right, thank you. So in this first example, we'll take a look at how the Flex button was used to provide a visual indicator to the user, indicating the presence of new data for the patient within the HIE, and then to take the user into that patient's chart within the HIE. Little brief housekeeping first. So I have two recordings here that I did of myself. These are recordings that I set up of myself, testing this out on various systems. What I find can happen is once we set up a system for the first time, the patients can purge over time. Oftentimes there's certificates involved behind the scenes for the data exchange. Certificates can expire. Testing servers aren't always online. I'm sure you've seen all of that as well. So what I do is whenever we have one of these hooked up for the first time, I like to get in and actually record it. So that's the only reason I'm doing a recording here. This is a recording, though, I did of myself. And in this example, I'm going to pause it here for a moment. The integration does run somewhat quickly. So what I wanted to do is just describe it briefly and then show you that in action, because some of it does run somewhat quickly. So within the hospital system, when a user has a patient identified and selects the Open Chart button over on the right-hand side, Flex button actually sends a query to the HIE asking if that patient has any new data available at that time, right then and there, real time. If the HIE does have any new data for that patient, they respond back accordingly, and we then display the Flex button on the user screen. So in the top right-hand corner, where you see that button labeled Mirth, that's the Flex button. And what we did in this use case was we added an additional visual indicator, so you can see that alternating, that flashing salmon pinkish color and gray color. That is that visual cue to tell the user that there is actually data for this patient out in the HIE real time. Now the user can really select any of these verb strips options that they want on the hospital side, but when they click the Flex button up in the top right-hand corner, what we do is we launch a separate window. We pass the user credentials right there. We pass that patient behind the scenes, and we bring that user right into the patient's record within the HIE. And then at this point, now that we have that record open in the HIE, we pass control. So the user can really control whatever they like. Now they're in the HIE, so they can navigate around within the patient's chart. So whatever the HIE offers at this point in terms of functionality, that's what we do. Take the user into that landing page. Just a few items on this specific use case, the button. So the physical appearance, size, the placement, the label, the alternating colors, which screen we used, that is all customizable per project. So what we try to do is just work with the hospital's team or whoever the end users are and really just interview them and find out which screen or screens do they think is going to work the best for their team workflow-wise. And then we would put the button on that screen. So we can really put the button anywhere on the screen where there's any free real estate. This customer just wanted to do the top right-hand corner. So at that point, Lauren, I wanted to pause, see if we might have had any questions come in on the question panel.
Yes, we have one question so far. It is, how do you handle it if our hospital participants have different EHRs?
So for that particular item, what I'm showing here is from the hospital side, for example, but I'll show an example here in a few moments as well from the other side of things. We can really put Flex button on the hospital side, on the practice side. To us, each one is really just a little implementation, a little project in and of itself. So we don't really care. It doesn't have to just be on the hospital side, for example. We can do this with Meditech, non-Meditech systems, on the practice side, hospital to define exactly which systems and screens they want. And each system and screen just tends to be its own individual project implementation for us. That's really the only difference.
Thank you so much. That is it on our questions for now.
Okay. Thanks, Lauren. So on this next use case, I wanted to show an example of how we use the Flex button to, starts out a little bit similar. We actually query the HIE when a certain screen is present from the hospital side. And in this case, the HIE returns back what we call care alerts. And if there are any care alerts for the patient, what we then do is display a little viewer for the user to actually view those alerts. The user can then expand that to see information about the specific alerts. So again, this is a recording that I did of myself. That's the only reason we're seeing a recording here. Bear with me one moment. Okay, so in this specific scenario, I have it paused for a moment. So this starts again with a patient identified. And in this case, when the user selects that open chart button on the right-hand side, so I have this paused for the moment, Flex button is going to query the HIE. asking if there's any specific care alerts for the patient. If there are care alerts, Flex button actually adds itself also to the top right-hand side in this use case, but again, we could put that button anywhere. So when a user selects the open chart, we send that query for the care alerts. See the Flex button appear in the top right-hand portion of the screen, and it says news with a 1. So what we did here is this particular HIE had various types of alerts. There's news type of alerts, that just their term, informational type of alerts, prior patient visits, care alerts. They also did prescription drug monitoring type of alerts. There's quite a few different buckets of alerts that they did. What we did is we did that little hover over tooltip so that if there are any alerts, the user just hovers over to see the count, the actual count of the number of alerts. And at any point, if the user wants to learn more about those alerts, they just click on the Flex button. We then create this additional viewer here with the details. So you can see the patient's news alerts, care alerts, prior visits. If this patient did have any medications in the prescription drug monitoring program, we would display those here as well. And then any of the textual, the notes, things like that, you can click on that as well to expand that and see more of the textual data if desired. So that's an example of one that we did. That happens to be the hospital side on the Meditech side. I did want to show an example as well of a non-Meditech system with the same item. So in this case, we did the same integration, but this is going to be on an Allscripts screen this time. I'm going to pause this here. This one also runs quickly. In this case, the hospital wanted to actually use sort of the tab view. So if you look in the Allscripts system, you can see the different tabs all the way on the right, where it says Crisp Flex Button tab. So in this case, we didn't actually put a separate dedicated button. We could have, but the hospital wanted to do this tabbed view instead. So everything I described for the Meditech workflow applies here for Allscripts, but we do that when the user gets to that Crisp Flex Button tab. So we send that query to Crisp, and any of those care alerts for that patient come back, and we display those right here. Very similar workflow at this point. Those can be expanded to see any of the details. So a couple variations of the same use case, a few different starting areas, but the same basic integration behind the scenes. Wanted to pause there, Lauren, see if there were any questions on that.
Thanks, Rich. We don't have any questions at this time.
Okay, thanks, Lauren. Well, I did want to sort of wrap up and summarize, but I did want to open the line for any general questions and answers. We can do that in a moment. So the Flex button can increase the use of the HIE and improves workflows for clinicians by saving time and money by giving them access to that important information within your HIE real time, also with those visual indicators if desired. And that was just two use cases that I wanted to show to get people's juices flowing. Really, the possibilities are endless because there's so many different possibilities and the use cases that needs vary HIE by HIE, site by site. I'd be happy to get together with anyone on the call today, kind of covered high level, some different use cases, but would love to get together and talk about how the Flex button can help with your specific HIE as well, getting folks into that HIE and taking advantage of that data as much as we can. So I did want to pause here, Lauren, and open the line at this point, see if there were any questions.
Thanks, Rich. We actually had one just come in, and it is, how much involvement do you need with the EHR vendor?
So for the button placement on the EHR side, everything I showed you today we did without the EHR vendor. We don't typically need help from the EHR vendor. We being the Flex button, the iAtric Flex button, we can actually put the button on the various screens. So the button placement that I showed you, that was us. iAtric did all of that. We can put the button on the screen, and then what the button does with the query and on the button click and all those different events, we're in charge of all of that. So far we haven't needed any EHR involvement or help.
Thanks so much. That closes our questions for today's webinar.
Okay, thanks, Lauren. I did want to include my contact information here as well. So as you sort of ponder those different use cases that I showed you here today, or maybe different what if scenarios, hey, I know Rich showed this, but I wonder if it could also do that, or variations, what have you. I wanted to include my phone number and email as well. Please feel free to reach out with any questions at all. I'd love to get together and talk those through, see how FlexButton can help.
Thanks so much, Rich, for a great webinar. And thank you all for attending. Of course. And as a reminder, you can take our survey for a chance to win a $100 Amazon gift card at the close of the webinar. Be sure to follow us on social media and check out our blogs for healthcare IT updates and to interact with your peers. If you'd like more information, please contact your Iatrix Systems account executive or email info@iatrix.com. Thank you everyone so much for attending. And again, thank you so much, Rich. I hope you all have a great day.
Thanks, Lauren, and thank you everyone for attending. Have a great rest of your day.